to know in order to dispose these masks. Now, let's move on to international occurrences that actually have local influence or have a bearing on the local scene. As COVID-19 deaths climb globally, President Donald Trump is doubling down on his decision to suspend funding to the World Health Organization, blaming it in part for not doing enough to stop the coronavirus pandemic and for being too lenient on China. Here is that story from VOA.
President Donald Trump on Wednesday confirmed that his administration is suspending funding for the World Health Organization pending a review, again accusing the UN body of being China-centric. Trump attacked the WHO for objecting to his travel ban from China, which he implemented in late January and has often touted as a decisive step to contain the coronavirus.
WHO's guidance had failed to control their borders at a very crucial phase, quickly unleashing the contagion around the world. That was a horrible, tragic mistake, or perhaps they knew.
In the early stages of the pandemic, Trump praised China and the WHO, but shifted his tone and threatened to suspend funding early last week. The U.S. is the WHO's main donor, distributing over $550 million last year, almost 15% of all contributions. The second and third biggest donor is the Bill Gates Foundation and the Gavi Alliance, both owned by American philanthropist Bill Gates. In a tweet, Gates condemned Trump's decision, calling it dangerous. There are many critics of the WHO who say its response to the pandemic has fallen short. Several countries also disregarded the WHO's guidance and imposed travel restrictions on Chinese visitors early in the outbreak. But even some critics believe a review of the organization's performance should be done after the pandemic, not while the world is trying to get the outbreak under control.
I think Trump is very wrong to do this now. Again, to sort of close the tap for the fire brigade while the house is burning. Even if he has some arguments, it's not the time to do it.
On top of fighting COVID-19, the WHO must address polio, measles, malaria, Ebola, malnutrition, and many other diseases. The organization said it will work with partners to fill the financial gap of U.S. withdrawal.
When we're divided, the virus exploits the cracks between us.
The WHO committed to review its performance to ensure transparency and accountability in due course.
My hope is that this pressure, which I think is probably warranted, will result in an investigation, but also in reform of the WHO to make sure that it is driven solely by the science of public health and not by the desires of leaders in China or anywhere else in the world.
With U.S. funding suspended, even WHO critics worry that Trump's move risks giving China an opportunity to expand its influence with the International Health Organization. Patsy Widakuswara, VOA News.
So those are the international politics or occurrences that may have a direct impact on the Kenyan scene. Now, to discuss this and much more on the coronavirus pandemic is Dr. Jackie Kitulu. She's the president of the Kenya Medical Association. Dr. welcome to Health Digest.
Thank you, Dr. Mercy. I'm delighted to be here.
Okay, great. Now, we've heard about the WHO cutting the U.S. government, through Trump, cutting funding to the World Health Organization. And we know that as a country, we rely a lot on donor funding for our healthcare system. Now we are in a pandemic. Does this funding cut have any impact on us? Do you see us suffering any shortfalls in our fight against the coronavirus because of this funding, if it's withdrawn or when it is withdrawn?
Indeed, Mercy, that announcement that the funding would be cut has met us with quite a lot of alarm, because WHO funding is critical for many areas in the direct resourcing of commodities, as well as in the area of technical assistance. So if we look at the resourcing of commodities, we are hoping that in the short term and at this time of the pandemic, that perhaps and then again, this is something being discussed and no one really knows what's going to pan out. But that in this short term, in response to the COVID-19 pandemic, that at least resources may continue to be availed for the fight of the COVID-19. However, remember that with WHO funding, that we are also resourcing several other commodities to deal with various illnesses. So then we look that perhaps then what might happen is that funding cuts will affect the technical assistance and even the resourcing of commodities in other areas like in the fight against HIV, TB, cancer. Remember, all these things will continue despite COVID-19 being present. So if these are going to get the bulk of, the funds may be withdrawn from that to fight the COVID-19 pandemic, then we are going to have major negative impact in these other areas. Remember, all these other illnesses are going to continue, and we need to find then ways of resourcing them commodity-wise, technical assistance-wise. So perhaps if there is not a call for funding from other sources, we might have really dire consequences from these funding cuts.
So what alternatives of funding then do we have as a country, or what alternative sourcing for our health sector, not just for COVID, but all the other areas of the health sector, do we have to look at as a country so that in case of such things playing out, then we are sort of cushioned and we are able to stand on our own 2 feet?
So, Mercy, at this time, indeed, that becomes a major challenge when all resources are being directed towards dealing with the COVID pandemic. And this is because we are seeing what's happening in other countries, in Europe, in the US, and the amount of resources needed to deal with this pandemic. So when we at a point where we know that we depend quite a bit on resources from other organizations and the WHO as such, then this comes to a point of sort of looking back at how do we reposition our available resources as a country. From which areas are we going to cut back to ensure that more goes towards the health system? And that's a big discussion that's on the table and is going on. Of course, I may not sit in the areas where that discussion will go on, but that repositioning the country's actual resources, of course, is critical. As well as I had mentioned that, yes, another call for around funding from the global front will be critical to ensure that services continue. Remember, much as we are talking about the COVID pandemic, there are so many other issues that will continue to be there: HIV, TB, malaria, the cancers. So looking at alternative sources will be really critical at this point. And this is going to be a discussion that's not just national, but also international with global partners and coming to a point of seeing what can we do then to ensure that we mitigate that unforeseen shortage on funding.
Okay, so talking of resources, an important conversation that has been happening is the resources going to the COVID response. And here we are talking specifically about the personal protective equipment for the healthcare workers and the masking, so need for masks by the public. I don't know what you have to say about this, particularly looking at the issue of masks, where on one hand, WHO says, reserve these masks for healthcare workers, but here several countries, not just Kenya, are saying, for the public, please do wear a mask while in public. What do you have to say about this, Dr.
All right, so on the area of masks, and the Kenya Medical Association has actually passed an advisory on that subject. And this, again, goes back to what is best practice and looking at the CDC guidelines, looking at WHO guidelines, but also not forgetting what is going on in the countries that are facing the pandemic. And even countries before this particular pandemic, and in the Asian countries in particular. That's one area where masks and the use of masks by the public has been widespread and for a long time. So from a scientific point, of course, we are always looking for evidence-based decisions. So from the evidence base we have so far, and which is where the WHO guidelines are coming from as well, that surgical masks, N95 masks, be reserved for the healthcare professionals, as well as for the patients who are infected in hospital and the caregivers. And that we will continue to promote. However, looking at new evidence and indeed dealing with this pandemic, we cannot exclude the fact that even masks for the general public do have a preventive measure from a public health point of view. Mm-hmm. And I listened to you demonstrate the use of masks, and that's the point we're saying the reusable fabric masks would be perhaps useful for the general public. Mm-hmm. Again, you remember, as you're aware, there are people coughing, they're sneezing. So at least even reducing the distance. So when we are saying social distancing, part of it is to reduce, if you sneezed or coughed, that there would be less moving in between me and you. Mm-hmm. So in that way also, if I'm masked as a member of the public, that makes a difference. So indeed, the directive by the CS and which you played a clip, suggesting that when you're in a public place, in a supermarket, in a car, and places like that, wear a mask. So indeed, we'll say to the public, wear the fabric masks, and we are glad that there are companies, local companies at that, who are making fabrics which are reusable, and that can be used by the public. There are also local companies that are working on making the surgical masks. And we applaud that effort, because there's a major shortage, and the healthcare workers definitely need those to be availed in plenty. The shortage, indeed, as you said, Mercy, is not ours alone, it is global.
It's global, yes. So, Dr. In now the countrywide response on the coronavirus pandemic, what do you think should be our strategy moving forward? We have done mass masking, we have done physical distancing measures, hygiene measures. What should be the next strategy if we are then to fight this pandemic without it causing dire consequences in our health system and dire consequences on our people?
So in terms of the strategy, I think there's different arms and different roles will be played by different parties. So if we're going to look at the government, they have a role. If you're looking at the public, they have a role. And healthcare workers, who are the frontline workers, have a role. So if I start with the government, that is the policy-making body. And the policies they set out, I think, need to be critically very clear and communicated to all and sundry, so that it is very clear what we need. Of course, the policies are directed to public health measures, and those are the measures that they have been passed out in terms of the measures that were initiated, even in terms of mandatory quarantine, for example, for the travelers who came in terms of the curfews, in terms of the lock-in, the restriction of travel from certain hotspots. Policies on testing, mass testing, because as we've seen, the more you test, the more you'll know, and you'll be able to, in terms of countries, you'll be able to, make decisive measures, preventive measures. So the policies that government set have to be very clear and communicated to all, and I think that is critical. Number two, the government also has its role in the resource mobilization. The resourcing, the resource mobilization is critical on many fronts in dealing with this pandemic. Critical to this is that you need human resources for health. You need the healthcare workers, who are the key frontline workers. Yeah. So the policies of government in terms of the recruitment of adequate numbers and training of them is number one. Number two, that they are protected, that there is enough protective, personal protective equipment that government must avail, whether it's from locally manufacturing, from the global front. That is their responsibility to ensure they have a protected workforce that is able to serve. Then subsequent to that, of course, is the infrastructure. That at this point we have a very small number. But as the numbers grow, we'll need hospitals, we need areas where these people who are unwell will have to be treated. So in terms of setting hospitalized for treatment, true. So around the counties, will we have then? Have we said will the government ensure that there's adequate facilities with adequate oxygen, the need for ventilators, which are an end point, but yes, that those are availed. Now, even as the government does that, there's also the point of ensuring that as you test more, that those who are positive will need to be isolated, quarantined. It means that people will not work. So it has a role in ensuring that the economy is stabilized in one way or another. And part of that is that when people cannot work, they need food, they need water, much as you're telling them, wash your hands, you need water, you need all those certain basics which the government must make policies on availing. So the resourcing is critical to their function.
Okay.
And then finally, the issue of ensuring that health services continue. All others, children will be born, people will have malaria, people need treatment, so all those are critical.
Okay.
If we move on to the public, what are we saying about the public? That the public, and you already mentioned some of the things that the public need to do in terms of the sanitation, washing hands with soap and water or using sanitizers, the social distancing, that's the idea around closing the restaurants and reducing the number of people in public areas. And this is an area where the public may have not really, in some areas there is a good response, but there are several markets where you'll find people unmasked and sort of mingling and forgetting about the issue of social distance. Okay, and of course, there's the advisory of staying at home where you can, if you can work from home.
Okay, so
those are areas we are saying public listen to the policies and follow the directives that are given.
So we all clearly have a role to play, yes, just from the government to the public to the healthcare workers, and that's for all of us. Dr. I have to cut you short because of time. But we look forward to hosting you again so that we can now actually start dissecting each of these particular points so that, we can see what our strategy is moving forward. Now, in response to what the U.S. said, the Director General of the World Health Organization has expressed his regrets over the United States' decision to suspend funding to the WHO after U.S. President Donald Trump's shock announcement. Speaking at a press briefing in Geneva on Wednesday, Dr. Tedros Ghebreyesus said that the WHO is reviewing the impact the funding withdrawal will have on its operations and has begun working with partners to fill any resulting financial gaps to ensure that its activities can continue uninterrupted.
We're committed to serving the world's people and to accountability for the resources with which we're entrusted. In due course, WHO's performance in tackling this pandemic will be reviewed by WHO's member states and the independent bodies that are in place to ensure transparency and accountability. This is a time for all of us to be united in our common struggle against a common threat, a dangerous enemy.
And so all of our guidance that was out before we did that press conference was about limiting exposure to people and to prevent transmission, particularly in healthcare settings, because all of our experience with SARS and with MERS showed that those viruses could have explosive transmission and amplification in healthcare facilities. And so we wanted to ensure that frontline workers were protected. And so our guidance that was put out was about respiratory droplets and contact protection. And so all of that was out on the 10th and the 11th of January. With regards to humidity and temperature, and I mean, if you remember, this began in very cold temperature, very dry, low-level humidity, and we are seeing this virus have the capability to to accelerate in a number of different climates. We need, as Mike said, we don't know how this virus is impacted completely yet. It's still new. We're still in the early stages of this pandemic in our 4th month, and we need to treat this virus everywhere it shows up as aggressively as we can so we don't give it a chance to take off.